In this video we're looking at lumbar-pelvic rotation control. So this test, the bent knee fallout, looks to determine whether the patient can control their lumbar spine whilst independently rotating their hip. So I'm going to set the patient in neutral. Ben, I'd like you now to just drop the right leg out to the side. And as you can see from the video there, his pelvis is rotating to the right side too, so he's giving into lumbar pelvic right rotation. Back up again. Then this time what I'd like you to do is try and maintain the pelvis in the same position it starts in. So if you imagine you've got a tray of drinks on your pelvis there, don't allow the drinks to slide to the right. I'm going to help you initially. Okay, off you go. So the patient's working the oblique abdominals, particularly on the right side, to control this one, and back up again. Okay, so he's got the feel of what he needs to do, so I'm going to ask him to do this independently now. Off you go. So the exercise is doable, but back up again, but quite a challenge. And again. So I think our patient needs to work on this particular exercise to improve their lumbar pelvic rotation control. We would do this on both sides, test the side that, and then do the work on the side that is the problem side. So the one that gives into the most rotation or is more difficult to control. An alternative to this exercise might be a heel slide. So Ben just straightens his leg out there. What I'm going to ask him to do is keep his pelvis level again, and then slowly bend his right knee out, keeping his heel on the bed. So as he brings his right heel up the bed, we're looking for the pelvis to stay level across here again. And then back down again, please, Ben. Good, and up again. Good, and he does that quite nicely. There's no rotations, no hitching. Okay, and then down again, and now the left one, please, Ben. So with the left one there was quite an amount of rotation to the left, and back down again. So we take you straight, so he's in neutral at the moment. Ben, if you just bend the left one again, please. And you can see from my hands there that the pelvis rotates down on this left side. So there's a give into left rotation. And back down. And Ben, if you can control that, do you think you can control that by keeping this side up? Okay, off you go. Hold there. Better, but not perfect. So unfortunately Ben fails this particular test. He has uncontrolled rotation to the left at the lumbar pelvic region. And therefore this exercise becomes a priority for him to work on, in addition to other abdominal exercises that will improve rotation control.